I'm often asked, is there a difference between a cosmetic surgeon and a plastic surgeon? And the answer is there definitely is a difference. And it's a concept that can be very difficult for a client trying to find the appropriate person to do a plastic surgery procedure. And a lot of times it comes down to definitions, but what it really comes down to is appropriate training. The specialty of plastic surgery is one that encompasses a variety of different procedures to help restore and reconstruct parts of the body that have been damaged through age and trauma. So a plastic surgeon who is appropriately trained is trained not only in cosmetic surgery, or the surgery to rejuvenate, but also in reconstructive surgery. Reconstructive surgery involves burn surgery, it involves hand surgery, it involves cleft lip and cleft palate surgery for those young kids that are born with facial deformities. It involves an arena of all these reconstructive surgeries. Cosmetic surgery happens to be one of them that is more prominent in the eye of the layperson because of the media scrutiny and exposure. So a plastic surgeon is someone that has an array of training and an array of specialties within plastic surgery arena. A cosmetic surgeon typically is someone that, by that title, is saying that what they specialize in and what they do is cosmetic surgery. And typically, it doesn't necessarily mean that they are trained appropriately and have board certification by the American Board of Plastic Surgery. And again, this comes back down to some of the laws in the state of Arizona, as well as the Arizona Medical Board. In Arizona, you can call yourself a cosmetic surgeon, but you don't have to be a surgeon. You don't even have to be a plastic surgeon. You could be a family physician and call yourself a cosmetic surgeon. You can be a general surgeon and say that you specialize in cosmetic surgery, but you don't really know what those physicians' real training is. The best training that a plastic surgeon can get would be to go through the 5 years of both general and plastic surgery training and then be board certified by the American Board of Plastic Surgery. There are people that don't go through that training but then call themselves a cosmetic surgeon, and you can advertise that way, and it becomes very confusing for the consumer. So there is a difference. You can be a board certified plastic surgeon and do strictly cosmetic surgery, but your initial training was in all those different subspecialties which I previously mentioned, and you just choose to do more cosmetic surgery. In my practice, I've trained in all those different specialties in plastic surgery, and my practice, because there's so many subspecialties, I've chosen to focus on breast reconstruction and cosmetic surgery versus a cosmetic surgeon that does general surgery and calls himself a cosmetic surgeon, and they're doing procedures which probably they haven't had enough training in to deal with the whole array of things that need to be dealt with. So the most important thing when choosing a plastic surgeon is to look at their training and look at their board certification, and also look at where they have privileges. In Arizona, the best question to ask a surgeon is where they do their surgeries, and could you have the surgery done at your local hospital. If you couldn't have the surgery done at your local hospital, it typically means they're not board certified to do the procedures they've been done.